Hi everyone, and welcome to A&P with Dr. O. In our video here, we are going to further explore the kidney. In the last part of the model, what they have done is they have taken one of those renal corpuscles, so one of these little ball-like structures here, and they've blown it up and let us see what's going on the inside. So this would be our circular structure, our renal corpuscle. And then on the inside, we would have this ball of capillaries known as the glomerulus. We have this covering then of the renal corpuscle, and this covering is known as the glomerular capsule. It's also sometimes called Bowman's capsule. And then we can also see blown up our tubules. So the one that is coming off first from the corpuscle is the proximal convoluted tubule, or PCT. So this would be the same as the first tubule here, again, coming from the renal corpuscle. And then this would be the distal tubule, and then we have the distal convoluted tubule, or DCT. So that tube right there is represented over here. What's going to happen is blood is going to move from the cortical radiate artery into the afferent or afferent arteriole, which blown up is right here. So blood moves through that afferent arteriole and then into this ball of capillaries, the glomerulus. And then blood is going to leave the glomerulus through this efferent or efferent arteriole. So afferens means to bring to. It's going to bring blood to the glomerulus. Efferens means to bring out. It's going to bring blood out and away from the glomerulus. The afferent arteriole is also going to have a larger diameter than the efferent or efferent arteriole. The reason for that is because we want to create pressure. So when blood comes through the afferent arteriole and moves through the glomerulus, because this diameter is smaller, we're going to generate pressure, which is then going to force fluids from the blood in these capillaries out into what's known as the capsular space. And that fluid is known as filtrate. And this is what's going to make its way into the proximal convoluted tubule, into the PCT. And as that fluid goes through the rest of these tubules, it is going to be modified. So additional wastes are going to be taken out. Additional wastes are going to be added. Anything that needs to be saved that's useful is going to be taken out. And anything that's considered waste is eventually going to become the urine. Again, the nephron is the functional unit of the kidney. It's going to be producing the urine.